Students in medical school right now, as medical school has become increasingly expensive with the complexity of medical education, now graduate across the country with an average of about $200,000 in debt. For those students to actually be relatively free in career choices, as well as not be influenced in how they practice medicine after they graduate, the goal for scholarship money should be to try to reduce the amount of debt that these students graduate with.
When I found out how much med school costs, I hadn't even ever seen that many zeros, not in my bank account at least, and I don't know. The concept of hundreds of thousands of dollars still is kind of foreign to me, but I know it's a ton, and I know, the salaries that my sister and my brother make in their jobs, and to compute how much time it would take to pay that back, it's pretty substantial. It's a little bit scary, actually.
Getting the scholarship made me realize that everyone supported my dream. It wasn't just me wanting to be a doctor, it was like a whole community behind me. And when Greenville offered me that scholarship, I realized it's exactly where I need to be.
So we started this medical school because of the physician shortage in the upstate, and we're looking to address the physician shortage in our communities. We're also looking to educate physicians differently than we have in the past so that they will actually be much more patient-centered in their care. They'll worry about the health of the population in our communities as a whole and continue to take very, very good care of patients who are ill. Remember that the students that we're attracting now and helping go to medical school with scholarship contributions won't be practicing actually in our communities until 10 years from now. These students are the future of healthcare in the upstate of South Carolina, and anything we can do, large or small in terms of contributions, to attract these students to come will mean we will improve the healthcare for ourselves in our later lives and our children as they grow up.
For the people who have given, I want to say the most sincere thank you, because you don't know maybe the person you're giving to, but honestly, when I opened up that email that said I had money, you cannot imagine the joy. We have worked so hard and worried so much about how to finance this, how to get into medical school, and just seeing that somebody else cares about something we care so much about is incredible.
We have a lot of big initiatives for Children's Hospital. We have gone from putting philanthropic dollars to things to putting philanthropic dollars into programs. And so we have a number of programs that we're very interested in expanding. One of them is transition of care. So we have done so well in a lot of the chronic diseases of children that they're growing up. They didn't used to reach adulthood, and now they're growing up, and we need to find doctors for them. And the doctors typically who we have now weren't trained in these chronic childhood diseases. So we want a program for transitioning these kids into adulthood. We think it's going to be a home run. Another program that we really want to promote here is one that deals with autism spectrum syndrome. You're seeing that a lot in the news today. We have one of the top ranked programs in the country. Dr. Des Kelly has shown great leadership in all of that. We have plans to really expand what we do for kids here in Greenville to children all over the upstate. And so you're seeing a common theme here. It's not just the medicine, it's the programs, it's the psychosocial support, it's the nutritional support, it's the family support, it's taking care of the whole family unit. That's what we want to be about in pediatrics.
Children learn about their world through play, and so by providing play allows them to master their experience of being in the hospital. Sometimes they also have a lot of anger and frustration and fear that get built up when they're here in the hospital or having to face the medical things. And through play, they can express that because they don't often have the words to tell us how they're feeling.
So to me, this is what philanthropy is all about. This is closing our dream gap. These are all programs that these doctors look at their patients and say, Dr. Schmidt, we need to do this for our patients. And so when we see the community jump behind these programs and say, yeah, we want to help with that, that's pretty cool. This is my chance to say thank you to all you wonderful donors who have supported Children's Hospital over the years. I've never seen anything like this. You have supported us for all kinds of things. Our Child Life program is there because of you. Our nutritional program is there because of you. Our obesity prevention program is there because of you. Our virtual toy drive is there because of you. Children have really benefited from everything you've done, and it's just, for me personally, it's wonderful to be in a community where there's so much support for what we want to do.
For our community, what Total Health means is a healthier community, and the Greenville Hospital System has done a lot for our community, including such things as the Swamp Rabbit Trail, and has sponsored the bicycle project downtown. All those things provide activities for our community members and for employees of our local businesses to try to keep them healthy. That's not only good for our community, but it's good for our local employers. It keeps their employees healthy, decreases absenteeism, and decreases medical costs. Philanthropic gifts to Greenville Hospital System are critical to the success of the programs I just mentioned. We're in a transition period right now in the country, transitioning from an old model of healthcare delivery to a new model of healthcare delivery. During that transition, funding for the kinds of things that we're talking about do not exist. So I'd like to thank our philanthropic donors for the money that they've given to Total Health and to the Greenville Hospital System. Without your philanthropic dollars, we'd not be able to transition from the old models of healthcare delivery to the new future models of healthcare delivery. It's critical to the success of those programs, and I'd like to thank you for your donations.
When we talk about doing things that are not routinely available in most centers, generally we're saying that we are beyond the usual offerings, and many times that means that we are very dependent upon philanthropy to make those programs happen. The things that we do in the Institute for Translational Oncology Research have thrived because of philanthropy, which has very much been supportive of these aspects since 2004. Day to day, the clinical trials that we're able to offer within ITOR are supported with the use of philanthropy, because many of these treatments are ahead of the standard of care. And when you're ahead of the standard of care, that means that most of those things are not things that are routinely reimbursed. Philanthropy has also been critical for the Center for Integrative Oncology and Survivorship. There have been key individuals, many of whom have said, I would like to remain anonymous, but I want an impact to occur within the Cancer Center that have supported our Moving On program, which is our form of oncology rehabilitation. And this is bringing patients from the side effects of treatment back to thriving. And in many cases, some patients say, this program has supported me to a level of well-being that I had not experienced even for years before going through the cancer process. Without philanthropy, without a really engaged donor basis, we could not make these things happen.
And one way that we could give back was, of course, with our time and talent, and that was certainly where Carmen has become really plugged into the Greenville Hospital System and the volunteer work she does there. The other thing was really helping to raise funds, because really at the end of the day it does take money to advance any cause, and particularly the fight against cancer. Some of us have the opportunity to give sweat equity, and some of us have the opportunity to give a lot more of our talents, and some of us it affords the opportunity to give back in a way that maybe we couldn't before, and that includes money. So those of us that have those different abilities, it takes all of us to reach out and to make a difference, and that's what it's about, making a difference in other people's lives.
I cannot deliver a thank you big enough to each and every one of you, because what we do every day is so dependent upon your support.
In the past, there was a phrase in neurology, diagnose and adios, and it really spoke to the limited interventions that we have. With the advancements in healthcare, the choices, the options for people living with neurologic diseases are vast. But we don't want to forget the personal touch, to be able to help people navigate through the medical process. One of the things I'm most proud about being here at Greenville Hospital System is a wide range of quality services that we have to provide to people living with various diseases. But one of the challenges is, how do you access those in an easy way? Many people affected by neurologic diseases have challenges with travel. And so one of our goals is to bring these resources together in one location to really enhance the ability to access the resources that they need. During the course of the disease, patients may need a wide range of services, ranging from physical therapy, nutrition, to resources from other physician specialties like pulmonary, gastroenterology. And so being able to bring those resources together in one location will really enhance the quality of lives of those affected by these diseases.
To be able to have that care close to home is so rare and so wonderful, because traveling is a very difficult thing at the end of life when you have ALS or MS or anything that affects your mobility. So something like a neurological institute in Greenville is so special, because there's so many patients that have these diseases that you don't even know about, that have MS and have ALS, and it's becoming more and more common than you realize. And I think when you have a disease like it, or you have a loved one who has a disease like it, you realize how many people are affected by these things and they don't have help. They don't have anywhere to go, and they have to travel, and that might not be an option for them. So it's really, I think there's a great need for something like this in Greenville.
I'm Joan McCauley, and Billy McCauley was my husband, who had Parkinson's and ALS. And Dr. Mary Hughes was his wonderful, wonderful doctor, whom we are so indebted to. And this is Sims Farnsworth. This is our 6th grandchild, who was born 2 months before Billy died. We just feel as a family that we will continue to give, not only the memorials, but we personally will give, each of us. And through the years, we will continue to support the Institute. We think it's so important.
What would Dad say if he was on my shoulder right now? and he would say, job well done. Job well done, Mary Hughes. Thank you.
So I really want to take the time to say thank you to all of those who have stepped forward to help us make this dream a reality, to those who helped raise awareness, to those who helped open the doors to people who can also help us fulfill this dream, to those who plan to give, and to those who have already given. What you've done will touch the lives of many people you may never reach, and for them and for myself, I want to say thank you.